So typically we see therapists working with a range of physical health conditions, such as somebody has arthritis or has had a stroke or has had a heart attack or has had some type of other neurological condition like Parkinson's that affects their ability to dress themselves, go to work, perhaps after a spinal injury, where there's a very major change in all of that doing every day. So those kind of physical neurological health conditions. Then the OTs that work in more mental health or psychosocial emotional health, where people might have a specific condition such as schizophrenia or a bipolar disorder or an eating disorder, where what they do every day is impacted by their mood or by their particular condition. So that's kind of mental health, right? Child and youth mental health, right through to dementia and caring for people with Alzheimer's disease, where the carers become clients as well as the person with the dementia. You might be able to structure their environment to help them remember what's going on and so forth. And then there are conditions which we call developmental lifespan conditions, such as developmental and intellectual disabilities, where because of people's cognitive limitations, their ability perhaps to live independently as they grow, as they go through childhood and into early adulthood might be impacted. So people might live in a family group home with residential care workers supporting them living in the community. OTs might go in and help those people, the residential care workers, or they might work with the individuals themselves around behaviour or around work skills so that they can engage in some type of supported employment, etc. And then there are people who work in sort of work, the sort of classic way people classically see occupation. So in the work area, OTs might work with prevention of injury or disability in a workplace through looking at occupational health and safety or ergonomics or work design of work sites so that people don't injure themselves. So they might look at risk and safety aspects. Or they might work with a worker who's been injured on the job and is trying to get back to work. Or they might work with someone who's had a catastrophic injury, like a spinal injury, and they need to look at whether they can go back to the same job or whether they need to look at other training, or they might need significant assistive technology to help them get back to work. So that work rehab area is really all about changes to the workplace, the structures of work to support somebody at work. And then I guess there's the whole area of paediatrics or children and youth, where OTs will work perhaps in the school system with children who need extra support at school, and they might need changes to desks or access to the classroom because of a physical disability, or they might need support in changing the environment for someone with autism who needs less distractions and more structure and more visual supports, etc. So places like Education Queensland employ OTs as well as physios and speech therapists to work in the schools to help children to make the most out of their education and to help teachers to support them to optimise their learning as well. One other that comes to mind would be something like Department of Housing, which is more for people who need public housing, and where you might have someone with a disability who needs public housing. So the OTs would work with designers and architects to ensure that the home environment for people is accessible if there's a physical issue, or somebody who might have a mental health issue. Sometimes housing can be designed to reduce noise, to give them private space, to have less coming and going, so that people who might be paranoid, for example, are not so worried about what's happening in the corridor outside, etc. So there's lots of reasons that people might need major changes to or particular design in their environment to help them live as independently as possible.
throw its cover